Yes, hi everyone. I'm John Simons from the University of Cambridge. It's my great pleasure to introduce Samantha Mitchell. Sam's in the third year of her PhD, supervised by myself and by Dr. Jane Garrison, and funded, of course, by Mental Health Research UK. Thank you, everybody, for your support. Sam was an undergraduate at Cardiff, and then we were lucky enough to recruit her to Cambridge, where she's been working very hard and making excellent progress on a number of PhD projects, focusing on the neurocognitive basis of hallucinations in schizophrenia. Over to you, Sam.
Thank you. Hi, I'm Sam, and my PhD investigates the brain mechanisms of hallucinations, focusing on reality monitoring and the medial prefrontal cortex. So there are approximately 21 million people in the world living with schizophrenia, and it is estimated that around 70% of individuals with schizophrenia experience hallucinations. It's also important to note that hallucinations are not only experienced in clinical populations. In fact, the lifetime prevalence for hallucinatory experiences in the general population is estimated to be around 5%. And yet, despite substantial research, there is still no clear, unified understanding of the causal mechanisms underlying hallucinations. One theory suggests that in schizophrenia, hallucinations may arise in part due to a deficit in cognitive ability termed reality monitoring. Reality monitoring is the ability to discriminate between information that is internally generated, so your imagination, your dreams, your thoughts, from information that is externally generated, so things that are happening in reality in the outside world. So in schizophrenia, in cases of auditory verbal hallucinations, for example, it is thought that inner speech may be incorrectly perceived to be generated by an external source, and so is perceived to be voices that are occurring in the outside world. Compared to healthy individuals, patients with schizophrenia have been found to perform worse on tasks of reality monitoring. And in patients, such deficits in reality monitoring have been associated with the presence of hallucinations. An area of the brain which has been repeatedly associated with both reality monitoring and hallucinations is the medial prefrontal cortex, and that's the area here highlighted in blue. Differences in activity in this area relate to individual differences in reality monitoring performance in both clinical and non-clinical populations. Importantly, reduced activity in this area has been found to be associated with poor reality monitoring performance in patients with schizophrenia. And within this area, research has highlighted the importance of a particular fold, the paracingulate sulcus, or the PCS. This fold in the medial prefrontal cortex is one of the last to develop in gestation. It lies dorsal and parallel to the cingulate sulcus and can vary quite considerably in its morphology. And by this, I mean it can be short or it can be long, it could be one segment or split into multiple segments, or it could not be there at all. In fact, bilateral absence of the paracingulate sulcus, and this is where it's not present in either hemisphere, is associated with reduced reality monitoring accuracy in healthy participants. And in patients with schizophrenia, Garrison and colleagues found that a 1 centimeter reduction in the length of the PCS was associated with a 19.9% increase in the likelihood that patients experienced hallucinations. But it's currently unclear why or how the PCS is related to hallucinations and reality monitoring, but it's likely that the PCS is a marker for other neural differences, possibly structural connectivity differences. The schizophrenia research has highlighted relationships between hallucinations and the white matter integrity of certain tracts within the brain. For example, reduced white matter integrity has been noted in tracts such as the cingulate bundle and the arcuate fasciculus in patients who experience hallucinations in comparison to patients who do not have hallucination symptoms and also healthy controls. And very recently, there is emerging evidence that white matter integrity differences of the cingulate bundle may also be related to differences in paracingulate sulcus morphology. So that's the background to my PhD, and my PhD can be summarized into 3 primary research areas. So in the context of hallucinations, I'm investigating reality monitoring, PCS morphology, and structural connectivity differences in several projects that I'll quickly summarize now. So the first aim of my PhD is to further our understanding of the link between reality monitoring and hallucinations, in particular whether this relationship is general to all modalities or whether it is modality specific. And by this, I mean in schizophrenia, auditory verbal hallucinations are far more common than hallucinations in other modalities, such as visual or olfactory. And so the question I'm asking here is, are all hallucination modalities underpinned by the same general global reality monitoring deficit? Or could the difference in prevalence levels be due to modality-specific deficits? And by this, I mean are auditory hallucinations primarily associated with an auditory-specific reality monitoring deficit, and so on. However, in the current literature, there was no task that was sufficient to tackle this question. Here you can see a common experimental paradigm used for assessing reality monitoring ability. Patients are either presented with a complete word pair, or they are presented with an incomplete word pair. And in this latter case, they will be required to imagine the second word. Later, they are assessed on whether they can correctly recall whether they perceived or imagined the second word of that pair. So I adapted this task paradigm to create a new task that can assess visual and auditory reality monitoring separately, but in a way that is directly comparable. So here is a summary of the new task paradigm. In the visual task, you are presented with pictures of either complete or incomplete famous pairs. So this could be Ant and Dec, Peter Pan and Wendy, Sherlock and Watson. And when the pair is incomplete, you are required to visually imagine the individual that would complete that pair. Later, you are asked if you can correctly recall whether the second individual of either pair was seen or imagined. For auditory task, you are presented with audio recordings of either complete or incomplete word pairs, such as Romeo and Juliet or fish and chips. When the pair is incomplete, you are required to imagine the word that would complete the pair. Again, you are later asked if you can correctly recall whether the second word of each pair was heard or imagined. Importantly, in this auditory task, unlike the original word pair task, there is no longer any visual input. So this task can separate reality monitoring modalities, at least visual and auditory, and I first used it to investigate reality monitoring and hallucinatory experiences, but in healthy individuals. This is because we know that non-clinical hallucinations are experienced throughout the general population, and the continuum hypothesis of psychosis would suggest that the same mechanisms would underlie both clinical and non-clinical hallucinations. However, findings here have been inconsistent. In particular, some studies have been unable to find this relationship between hallucinatory experiences and reality monitoring in the general healthy population, despite this relationship being a pretty consistent finding in patients. If the true relationship between hallucinations and reality monitoring performance is indeed modality specific, then in healthy individuals where the severity of hallucinations is lower, studies only probing modality general reality monitoring and hallucinations may not be using precise enough measures to find a significant relationship. And this new task allows us to tackle this question. So, after many stages of task development and piloting, I conducted an online study using this task with 120 healthy individuals, aged between 18 to 30 years old. And in addition to the reality monitoring tasks, I collected measures of modality-specific hallucinatory experiences and mental imagery vividness. And I'd like to highlight that the following results are preliminary. Here you can see that healthy participants perform significantly better on visual reality monitoring compared to auditory reality monitoring. And if this finding is replicated in patients, this alone could be a possible explanation for the higher prevalence of auditory hallucinations. And as you can see here, despite looking at visual and auditory reality monitoring modalities separately, we do not find any evidence of the relationships between reality monitoring and hallucination experiences in either modality. In fact, Bayesian analysis highlights moderate strong evidence that there is absolutely no true relationship in either modality. And therefore, we find additional evidence that questions this continuum hypothesis. But as I say, these results are preliminary, and more extensive analysis of the data will be conducted in due course. The second aim of my PhD was to develop an updated protocol for PCS identification and measurement. Due to the considerable variability in the fold's presence and morphology, identifying the PCS can be difficult. Here is an image shown to you earlier where the PCS was traced manually on a single slice of an MRI scan. We are now able to use 3D reconstructions of sulci in software such as BrainVisa, and this also provides additional information such as the depth of each sulcus. And as you can see here, I have labeled the paracingulate sulcus in green. A colleague and I worked together to develop an updated protocol for use in 3D software such as BrainVisa to allow researchers to more accurately and reliably identify and measure the paracingulate sulcus. To reduce the ambiguity of PCS identification, the protocol provides a specified order for sulci identification. In particular, the protocol instructs you to identify less variable sulci in the area first in order to aid your subsequent identification of the PCS. The protocol also provides in-depth guidelines for expected location and trajectory for each sulcus. So using these guidelines, you would first identify the callosal sulcus, then the cingulate sulcus, and then any paracingulate sulci elements. And I'm very pleased to say that we made the protocol publicly available at the end of last year, and a manuscript is currently in process of being written, which validates this protocol against various data sets. Aims 3 and 4 of my PhD centre around applying this updated protocol to various data sets. Firstly, I aim to assess whether we can find the relationship between PCS length, psychosis, and reality monitoring as early as adolescence and childhood. The ABCD dataset is a collection of various measures, imaging, cognitive, behavioural, from over 11,000 children starting at age 9. Here, I'll be investigating whether PCS length at such young ages correlates with early measures of psychosis risk. The NSPN cohort is a longitudinal study of 2,400 participants, and a subset of these individuals, aged between 14 to 24 years old, were previously scanned. After completing a new online reality monitoring task, I will investigate whether their PCS length from these previous scans can predict their current reality monitoring ability. And I've also recently been granted access to datasets from King's College London of 140 individuals at high risk of psychosis. I will see whether PCS length differs between individuals at high risk and healthy controls, and whether PCS length predicts later psychosis development. And as I mentioned earlier, there is evidence suggesting a relationship between hallucinations and the integrity of certain white matter tracks in individuals with schizophrenia. However, to my knowledge, white matter integrity has not been investigated in relation to reality monitoring. To address this gap in the literature, we are currently in the development stages of an imaging study using T1 MRI, fMRI, and DTI. This study will utilise the reality monitoring task paradigm conducted by Garrison and colleagues in their 2017 imaging paper, and the study will allow us to collect and investigate measures of reality monitoring performance, task-related activity in the medial prefrontal cortex, PCS length, and white matter integrity measures, to examine whether the tracks previously associated with hallucinations in schizophrenia are also related to reality monitoring ability, associated functional activity, and PCS morphology. And I would like to thank you all for listening, and I would like to express my deep gratitude to Mental Health Research UK and Rose Trees Trust for funding this research, and I would happily answer any questions you may have.